Hello and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about something known as ankylosing spondylitis. Now, we've talked about inflammation on this show before, rheumatoid arthritis, but this is a little bit different. Ankylosing spondylitis is an inflammatory disease that can cause the vertebrae of your spine to fuse together, which is extremely painful, as you might expect. Now, AS usually begins in the teens and early 20s. In fact, most people who have AS will experience their symptoms before the age of 30. Only 5% get symptoms after the age of 45 or later. The more common symptoms are heaviness in the feet and lower back, extremely swollen hands and other extremities, and then there's iritis, which can look like this. You don't want this. Nobody wants this. So now let's talk about words. Ankylosing spondylitis comes from some Greek words, so here we go. Ankylos meaning crooked, spondylos meaning vertebra, and itis meaning inflammation. Remember, itis is always inflammation. In the most severe cases of AS, it can lead to new bone formation on the spine, resulting in a hunched posture called kyphosis. It's painful, and, as exemplified by the red spine there. So here's a comparison. You've got your normal spine on the left, and then here is an AS spine on the right. And trust me, that amount of curvature does not come without great pain. Now, men are more likely to develop AS than are women. In fact, twice as likely. Most people who have AS have the HLA-B27 gene. However, many people who have this gene never develop ankylosing spondylitis, and scientists really aren't sure why that is. As far as treatment options, you've got NSAIDs like Celebrex, ibuprofen, and Voltaren. These are commonly used to treat arthritic conditions, though high doses can cause gastrointestinal problems. Next up, we have sulfasalazine, which has been shown to help with inflammation as well as controlling intestinal lesions associated with inflammatory bowel disease. Then we have methotrexate, which is a chemotherapy drug that has been shown to work well in treating rheumatoid arthritis. And then we have corticosteroids, the most infamous of which is prednisone, and it's horrible. We're talking about side effects like significant weight gain, intense mood swings, hypomania, aggression, bone loss, and the possibility of significant permanent damage to your immune system. I'm not even kidding about prednisone, okay? Drugs.com lists about 80 side effects for this medication. It really should be a last resort for everybody, because the longer you're on it, the worse those side effects will get. There's also a class of meds known as Biologics, or TNF blockers, like Enbrel, Remicade, Humira, and Simponi. So what the heck is TNF? Well, TNF is a chemical produced by the immune system which creates inflammation in the body. Now, for healthy people, excess TNF in the blood is blocked just as a matter of course. It's no big deal for them, but in those who have rheumatic conditions, higher levels of TNF in the blood will lead to more inflammation and persistent symptoms. One other thing to keep in mind is that biologics can be very expensive. One dose of Remicade can cost up to $2,500, so you really want to make sure that your insurance is going to cover this before starting down that road. As far as non-medication options go, exercise can help. We're talking about exercises that focus on strengthening as well as increasing flexibility and range of motion. However, before you embark on any new exercise program, you really should talk to your doctor about it, because between the two of you, you can tailor a program to your specific needs. It's a good idea, but just be careful when you do it, and all things in moderation. Bottom line, AS is a lifelong disease. There is no cure. Now, some of these medications can help mitigate the worst of the symptoms, but many people experience such devastating pain from this that it leaves them wheelchair bound. So if you know someone with AS, I would encourage you to do two things. One, learn about their condition so that you can speak to them about it intelligently. And two, Give them some compassion. They deserve it. And you will be a better person for doing so. Sound good? Good. I'm glad you agree. And unfortunately, that's all the time we have this week. You can always send me your questions and comments to ken@don'tpunishpain.com. You can also follow me over on Twitter @don'tpunishpain. I will be back next week, and until that time, I'm Ken McKim. You take care.